And that's really what the Chinese tongue stuff really is. It's about asking more questions and really helping our patients understand that their tongue health matters just as much as their oral health. Chinese tongue diagnosis came from was the Chinese practitioners started mapping the tongue based on the symptoms that they were seeing for a patient. And so I always use the metaphor, you can walk around and not know you have a heart problem, and then all of a sudden you have, a massive heart attack. Well, that's the same with periodontal disease. So I think if we really embrace Eastern medicine with our knowledge of Western medicine and really cross over, we're going to be better practitioners for our patients.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, an Endeavor Business Media production. This is episode number 404. I'm your host, Andrew Johnston, and thank you so much for making us a part of your day. I just got back from ADA SmileCon, and oh boy, howdy, did I have a great time. I'll try and send some pictures and put them in our social media of what the podcast lounge looked like. They did a phenomenal job last year, but this year they stepped it up even further. It's super elaborate. It's amazing. Also, shout out to Kate Davidowski for, one, putting all this together and inviting us, but two, for finding my power plug the next day that I accidentally left behind. I really wish I could say that was the first time that has happened, but it was not the first time. It was I don't know how manyth time. It was a lot though. But yeah, the area for the podcast space was incredible. I just can't even tell you how amazing it was. There was this main stage. It wasn't so much like stage, but it was kind of like a news desk, like you see on major TV networks or ESPN broadcasters from back in the day. And then if you wanted to go there and watch the kind of main stage podcasters, there were beach chairs that were all laid out for you to watch and relax, kind of, kick your feet up a little bit. If you've been out like wandering the exhibit hall all day long or whatever and just wanted to have a place to sit. There was also a coffee truck right there. There were kind of towards the back individual booths for podcasting. It was just so well done. Thank you everyone, by the way, for those that came and watched us perform from the main stage. It was really fun. We had a collaborative effort with Dr. Pam and Dr. Rice from Dentistry Unmasked. And so that was really fun. And while I'm on the space of thanking people, thank you to Misty Mattingly, who spent all day podcasting with me. There's some really good episodes coming up. I think we recorded 8 or so episodes that are coming up from the weekend. And so those will be coming out over the next couple of months, I think starting with next week with Tom Viola. But again, thank you to the ADA for inviting us and doing such a freaking great job with that space. It was really amazing. So this week on this episode today, we welcome in Lani McBeth to the show, who I think in the interview, I said Lani multiple times, which I know is the wrong way. Now I know after the fact, I learned that, but she talks to us today about Chinese tongue diagnosis, which is kind of the ability to see the health of different parts of the body based on the appearance of the tongue. It was an absolutely fascinating episode to record. I'm very grateful that she took the time to record with us. So thank you, Lani. You guys are going to love this one. And then next week, like I mentioned, we have Tom Viola coming back to the show. It's actually been a little bit since he's been on. And so I'm really excited that he came back. And he's back to answer kind of definitively that question that's always looming regarding if doctors should be scared of hygienists doing local anesthesia. So it was a great episode. Both he and Misty had excellent points of view. You're going to love that one. That's coming out next week. So that is all for me for this week. I hope you're having a lovely October so far. Please enjoy this episode with Lani McBeth.
A tale of two hygienists.
Welcome everyone into the interview portion of the podcast. I am excited. I am joined by Lani McBeth. Lani, thank you so much for making time for me today.
Absolutely. It's my pleasure. I'm excited to be here on Tales of Two Hygienists.
Well, honestly, like I was just telling you before, like I've seen you like around like so much. I'm surprised we haven't had you on before. Today we're going to be talking about Chinese tongue diagnosis. It was absolutely, I think you made a post about it somewhere and I saw it and I'm like, okay, like, look, we have to have her on and talk. I don't think we've ever talked about the tongue on the podcast. Isn't that weird?
That is weird.
And some odd episodes later. So let's do this. Let's start off with a little bit of background, kind of your hygiene life. Like, where did you come from? Kind of the whole thing. And then how you got interested in Chinese tongue diagnosis.
Absolutely. So number one, I've been a hygienist for 37 years. So I'm been in the clinic in the operatory for that whole time that I've been there. And probably about 25 years ago, my mom had a massive heart attack at the age of 57. And she had had her upper teeth pulled the week before. And I'm like, damn, there's a connection here. Something's going on. So I started really doing a lot of research then. So I adopted the systemic, the oral systemic link a long, long time ago. And then as my career progressed, it led me down the path to really look at, what we're doing as traditional hygienists and where is there more? And so a couple of years ago, I started working for a holistic biologic doc and then went down the path to get certified as a holistic hygienist. And through that training, I knew I was going to have to do a presentation or a paper or something of that nature. And I could have done something, just like what I do every day in the operatory. But one of the episodes of our training, there was a little information on Chinese tongue diagnosis, and that just stuck in my brain. So when I was done with the training, I started researching on Chinese tongue diagnosis and what I have learned about it, and in talking with patients and looking at their tongue from a different perspective of what we would normally see. And it just has really led me down a different path. And what it has allowed me to do is really help my patients become more advocates for themselves in their primary care doctor's office. Yeah. And it's been interesting to watch their journey as we've had conversations about their tongue. So,
which is awesome because that's what we want. We want our patients to be kind of their own advocate, that we want them to be a part of the health system. We can't always be dictating to them, like, brush your teeth, do that. Do. It's supposed to be collaborative in nature.
Absolutely.
So, okay. So where does one start in the research phase? Because I would imagine there's 1,000 points to just jump into.
There are. So I actually got online and I got a book on Chinese tongue diagnosis and started reading that. And then I went down another path with Ayurvedic tongue diagnosis. So there's lots of different ways. They're all very similar in nature. Mm-hmm. But really, it's just looking at what we already see in the mouth, right? In traditional tongue stuff, the biggest example that I have is, geographic tongue. We look at geographic tongue as it's migratory glossitis. There's no real, we look at it as benign. It's not really doing anything. They may have some sensitivities, to different foods and spices and those types of things. But other than that, we really don't have anything to offer our patients. Well, in learning about the Chinese tongue diagnosis, my whole world opened up and I have a whole different perspective about geographic tongue now. In Chinese tongue diagnosis, the Chinese, way back before Christ, they needed to have a system to really look at how they determined patients' health. And the easiest thing, without having to touch a human's body, was to look at the tongue. And that's really where the history of Chinese tongue diagnosis came from, was the Chinese practitioners started mapping the tongue based on the symptoms that they were seeing for a patient. And so The tongue itself is mapped out. So the tip of your tongue is related to your heart, which when you think about the tip of your tongue, they say, don't ever let words fly from your mouth because unless they're coming from your heart. Well, that's kind of the thought behind it, right? So the tip of the tongue is the heart. Right behind it is the lungs. Down the center portion of the tongue is your stomach, your spleen, your pancreatic health. The distal part of your tongue is related to your gut, your bladder, and the root of your tongue is related to your kidney health. And then the sides of your tongue are related to your liver and your gallbladder. So here's an example. I had a patient who was in the practice. She had one area that had geographic tongue on it. And I started talking to her about different things, her sleep, I ask out of the box questions, constipation, insomnia, really delving into from a medical history side. And I always ask the patient, are you open to hearing more about what your tongue is telling us? And so I get permission from them to really talk about their tongue because they're not there necessarily to hear a lot about their tongue. They're there to hear about their teeth. And this response is always, absolutely, tell me more. So this particular patient, she had a spot on her tongue and I said, well, this area of your tongue is related to your gallbladder. So the next time you're at your functional medicine doctor, I really want you to ask some more questions. We also delved into, she was having some issues with sleep. So I saw her, 2 months ago, and she had a sleep study and she had insomnia. And they discovered that she had an AFib problem with her heart. And then the spot on her tongue, they actually dug deeper and her gallbladder is leaking. And that is stuff that would not have even been discussed or even, I didn't diagnose anything for her. I just said, you need to ask more questions. And that's really what the Chinese tongue stuff really is. It's about asking more questions and really helping our patients understand that their tongue health matters just as much as their oral health. Interestingly enough, I have a friend who is in biologic dentistry, and I'm going to be presenting a course on Chinese tongue diagnosis at the New Mexico Dental Hygiene Association meeting next month. So the course is launching, I guess, is what I should say. But I asked her if she does phase microscope stuff for her patients. And interestingly enough, she sent me a slide or a video of an 8-year-old. And his plaque didn't really have any pertinent bacteria in it. But his tongue, the bacteria on his tongue had tons of spirochetes in it.
Interesting.
As an 8-year-old. Now, when we think about spirochetes and their involvement in our brain health and all of those types of things, this is an 8-year-old. His brain is in development. And if we weren't looking at the bacteria on his tongue, we would not have known that he had spirochetes present in his mouth. And that needed to be addressed and talked about. So I think, what the Chinese tongue diagnosis stuff has done for me is it has opened up opportunities for me to help my patients even more. We look at a fissured tongue and say, it's a fissured tongue, right? Well, now I look at a fissured tongue and I start asking questions about their hydration and how they're hydrating themselves. Our tongue, all of our fluids and our coating on our tongue is produced in our stomach. So if our stomach's not processing our fluids well, or if we have too much bacteria, it's because there's more fermentation and stuff that's actually going in there and is not being eliminated or, taken out of our body. It's actually putting itself on our tongue. So when we see those really heavy, coated, greasy-like tongues, their systemic health is in trouble. Mm-hmm. It's more rooted. It's more deeply impacting their overall health, even though they may not know it. It's sort of like when we talk to patients about their perio health, and that I always use the metaphor, you can walk around and not know you have a heart problem, and then all of a sudden you have, a massive heart attack. Well, that's the same with periodontal disease. So I think if we really embrace Eastern medicine with our knowledge of Western medicine and really cross over, we're going to be better practitioners for our patients.
Oh my gosh. And that's the freaking goal right there, right? Like we want to be you're probably a part of a much bigger off-topic conversation of we want to provide value to our patients when they come in. We don't, as hygienists, want to be thought of as tooth scrapers or, just the pro-female situation. Like we really want to help people, and we want to garner the respect of the medical community, our doctors, the assistants, the front office. Like we really want to put ourselves in a position where we are thought of highly. And this kind of conversations with our patients, this type of partnership with our patients is a way to do this. I would love if you would go through I don't know if it's called the assessment phase, but walk us in, I'm a patient in your chair. I'm not going to really show you my tongue, don't worry, but I'm a patient in the chair, and you've already approached, are you willing to talk more about this, or are you wanting to learn more about this? What do you do first? Is it a visual inspection? Is there a palpation? What is that exam or assessment look like?
So in Chinese tongue diagnosis, most of it is a visual assessment. Of course, I'm doing a really thorough EO-IO oral cancer screening. So the nice part about this is that it's not taking me a ton of extra time when I'm doing this, right? So I usually have them stick their tongue out. I hand them a mirror. I show them what I'm seeing. I usually take an intraoral picture of their tongue. And, the key component in Chinese tongue diagnosis is the color of the tongue. And the color of the tongue really tells us a lot, whether or not they have poor circulation, whether or not they are struggling with what in Chinese medicine, it's called hot and cold in their yin and yang area of their body. But it's really no different than what we do in Western medicine, right? So a bright red tongue is telling us that there's a problem with how the blood is flowing through the body. And if the tip of their tongue is bright red, well, I already shared with you what the tip of the tongue tells us, that there's something going on with their heart. So then I go, are you seeing a cardiologist? And if they say no, I ask them, do they have a family history of heart disease? And, usually patients either have a family history or they're seeing a cardiologist. So I just share with them that the tip of their tongue is red and that there may be something going on with their heart, and they want to have a more in-depth conversation with their cardiologist or their primary care doctor. Prevention is worth, my grandmother used to say, an ounce of prevention is worth a pound of cure. Mm-hmm. And that's really what it's about, right? We're the preventive specialists for our patients. So it's getting them to really do what they need to do. So you look at their color of the tongue, and then the coating is really the next big factor when it comes to Chinese tongue diagnosis. If the coating is just a light white, that's very normal, healthy coating. The more yellow it is, the more rooted the problem. And in diabetic patients, it's really interesting. And of course, we have undiagnosed diabetes is in epidemic proportions in our country. And what if we could help our patients to actually go and get those diagnoses if we share with them that the coating of their tongue is showing us something more? Yeah. So it's really just about having the conversations with them. And I actually have stepped away from my full-time position and am just temping as a hygienist. So there's going to be people on the podcast that say, oh, well, she's in a holistic office. All of those patients are receptive to what she's saying. Well, as a temp hygienist, I actually have brought that information into those practices every single day. I do the same thing with patients that aren't expecting the conversation. I ask them, are you open to learn more about your tongue? And it is amazing, Andrew, how many people are like, yeah, well, what is it telling me? Right? I had an oncology nurse just this week, and she was like, tell me, I want to prevent things. So,
how are like the doctors and the staff like reacting to this crazy person coming in and like analyzing the coding of people's tongue?
It's actually kind of interesting. Yesterday I was in an office and I had done my EOIO, and the associate doctor came in and I was in the middle of my EOIO. And I started talking to the patient about his tongue tie and his, the coating on his tongue. So after I finished, she said, "What was that? I want to know more. Do you teach this? Do you bring this to the office? Can you teach the other hygienists in our office about this?" So I think practitioners are looking for what they can do more for their patients. How do they customize themselves to make them different and stand out in their community? And we know patients will go and talk, right? They'll go and say, hey, this is what the hygienist told me today.
Yeah.
So it's really just being honest about what you're doing and why you're doing it and giving them information. It's kind of funny. At SmileCon last year, we were in Zurich's like after hours cocktail party, right? Mm-hmm. And Amanda Hill and Susan Cotton and I were all standing there, and I had just really, kind of delved deeper into the Chinese tongue diagnosis. And Amanda's standing there sticking her tongue out at me going, okay,
just
what
like
is
Amanda
it?
Does. Weirdo, but yes.
What is it telling me? So, of course, Kelly Tanner's like, what are you guys doing? It's a door of opportunity for every clinician to step up their game. And, we're in an interesting time as hygienists, as we see across the country where dentists are saying we're going to bring on assistants and, have them do the scaling and, those types of things. We can be afraid of that, or we can say, how do I elevate my game?
Yes.
So, we watched it as nurses became nurse practitioners, right? Mm-hmm. They were able to elevate their game. And so I think everything that we learn elevates our game to make us that much better. So
I have a couple of questions that popped up in my brain as we were talking about the coating of the tongue, right? How do you differentiate between like what we would always attribute to, oh, you're a smoker. Okay, and that's it. Like it's because of you're a smoker, and not just like write that off and just be like, okay, that's it. And because there could still be some underlying condition, right? Like how do you differentiate between that?
So number one, finding out, are you a smoker? I mean, there's a lot of people that I have asked those questions and they're not smokers, but their tongue looks like a smoking tongue. I ask, number one, I tell patients that the best time to really look at their tongue is first thing in the morning, because that's where you're going to see the most realistic colors before they've had coffee, before they've had, their morning breakfast, before they've had their morning cigarette, those types of things. But when you ask questions about their medical health, you get better answers about what the coding actually is revealing to you. So if they're a smoker, you have to kind of look at the coding from a different perspective. Is it thick? If the coating is really thick and has a coloring to it, we know that it's way more than just them smoking. So it's the depth and I don't know. You've seen tongues where they have that really greasy looking coating, but they have a color to them. Even black hairy tongue, we'll attribute black hairy tongue mostly to antibiotic or wine or those types of things. It's not just that. There's other things that are happening systemically. A lot of times it's all related to the gut health. And, we know gut health, the microbiome is out of control in most of our patients' worlds. So,
yeah. So you mentioned earlier, we'll go back to like the scenario of like the patient presents, they have maybe like that bright red on the tip of their tongue, right? Is there, you think about this is not going to come out the way I want it to come out. I'm thinking like oral cancer screenings. A lot of times when we see things, we're like, okay, when did it first get there? When did you first notice it? How long has it been there? You ask these questions, right? A lot of time though, between either us and the doctor or the patient, we determine, look, this is probably nothing. You're just wait 2 weeks. If it's still there, then we're going to either biopsy or refer you to biopsy or whatever. Is there also that similar 2-week waiting period? Or is there could someone just have a bright red tongue and there not really be anything, and then we'll check it in 2 weeks and it's gone, and then on their recall again it's gone, or the recall again it's gone, then we're like, okay, you're probably all right?
I don't really have an answer for that question because I haven't really seen a lot of red tongue issues for patients. Mm-hmm. When I have, usually there are already cardiology involved. And so I usually, just share with them that they want to make sure that they're keeping up with their appointments with their cardiologist. Are they monitoring their blood pressure at home? Really try and help them to become, again, an advocate for themselves, right? And just share with them that their tongue just shows that sometimes the blood flow is not great or those types of things. And blood pressure is one key thing that we can have them do at home. Something that they can monitor on a daily basis that's going to give them some more information to go back to their cardiologist and say, hey, can we check my enzymes? Can we check the blood enzymes to make sure that I'm not at risk right now? Or is my blood pressure medication no longer working? Do we need to change things up? The other factor is, how are they sleeping? Because we know that sleep is such a component for everything from a health perspective. And if they're not sleeping, then somehow we need to help them address that as well, right? Mm-hmm. So it's all, there's so many things that are intertwined and it's kind of crazy, but.
Well, and I think that you made a really interesting and I think pertinent distinction there is they could already be seeing a specialist for these issues, and these issues could be quote unquote well managed, but it's still worth having a conversation just in case it's not, right? Just in case there is something it's well managed, but let's, maybe have them just do another check. I want to talk about, as we're closing things up, and this is kind of, I guess, you are temping, so it's probably a little bit harder for you because it's harder to have a system in place. But in an ideal situation for the hygienist to have a referral process for, I guess, would be Western medicine at this point.
Yeah.
The East versus West. How does that? Because I think a lot of us are very much you got a heart doctor, great, go see him. And that's it. There's no forms, there's no follow-up. What kind of conversations should we be having with our patients as far as the referral process goes?
So when I was working full time, I actually would type up a really quick note and have it printed just saying, I want you to ask these questions of your primary care doctor or your cardiologist. And really those questions are simple. What was my last blood tests? What was my A1C? And often when it comes to A1C or diabetes, or I'm getting way off track here for you because you're asking me for a system. The real key is trying to get them to take care of themselves. If you have their primary care doctor's information, you have to ask permission from the patient to actually send a note to the primary care doctor. And I would just quickly shoot an email to the primary care doctor and just say, Betty Jones was in my chair today and we noticed this on her tongue. We're a little bit concerned that this may be a sign that she may have some systemic stuff going on in this area of her body. We would encourage you to reach out, or, we've encouraged the patient to reach out to you and schedule an appointment to discuss that. So they're not like caught off guard that we have referred a patient back to them, is really what the key is. So, you have to start with one conversation, right? One letter, one email. And it's amazing how many will actually reach back and say, thank you for the referral kind of thing. Thank you for sending it back. It is no different than when we refer patients to an oral surgeon or to a periodontist or to an endodontist. Somehow there's communication that actually happens. It starts with us.
Well, I just, in my mind, I'm thinking, I wouldn't mind living in Western Washington, anywhere up the I-5 corridor. I'd be happy to send in, like, I saw this thing on their tongue. I think it might correlate to their pancreas or whatever, I would have no problem doing that. But in Florida, I can just imagine, and this is not a slight to like the medical profession in Florida, but they'd be like, who is this crazy hygienist thinking that they know anything about medicine? Oh my gosh. I mean, but the thing about that is like, you just can't be afraid. Like, right. You're there for your patient. You have to be an advocate for your patient either way. And can't really worry about what the medical profession is or isn't going to do for their patient. Lani, this has been great. I mean, I feel like there's so much more here. I know you have courses. You said you're going to New Mexico and doing that. Where can someone find you, maybe on either social media or a website, that they could see where your next course is, or sign up for a course that you're taking, an online course or whatever?
So right now, just finding me on Facebook is probably the easiest place. The website's not, it's in progress,
Sure.
It's all about, building enough confidence for me to launch myself has been a challenge, but I've had people behind me pushing me saying, Lani, you have to get out there and you have to start talking. So it's been a journey for me to actually come to this point where I feel comfortable enough to even come on a podcast and share this out of the box, thought, right? It's different.
I love it. I'm so glad that you found the courage to do that, because this is so awesome. I think this is going to be one of the most fascinating episodes that we receive feedback on, probably this year. So thank you again so much. Is there an email address you're willing to share?
Just Lani McBeth at Gmail.
Awesome. Thank you very much.
Thanks. Bye.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.